Hello everyone. In this video, we are going to talk about something that affects us all, sleep. Yes, 9 habits that ruin our sleep and also how to deal with it. Number 1. Blue light exposure. Habit number 1 is excessive blue light exposure. Staring at screens before bedtime can disrupt your circadian rhythm. Try switching to warm lighting and avoid screens at least half an hour before bed. Certainly, blue light exposure refers to the light limited by electronic devices such as smartphones, tablets, and computers, as well as artificial lighting sources like LED and fluorescent bulbs. It is called blue light because it contains a higher proportion of blue wavelengths. Excessive exposure to blue light, especially at night, can have several effects on our health. Number 1. Sleep disruption. Blue light can interfere with our circadian rhythm and suppress the production of melatonin, a hormone that regulates sleep. This can lead to difficulty falling asleep and poor sleep quality. Number 2. Eye strain. Prolonged exposure to screens can cause digital eye strain, which includes symptoms like dry eyes, headaches, and blurred vision. Number 3. Increased risk of eye conditions. Some studies suggest that prolonged exposure to blue light may contribute to the development of age-related macular degeneration, AMD, and other eye conditions. Number 4. Impact on mood. Blue light exposure at night can affect mood and contribute to symptoms of depression and anxiety. To reduce the negative effects of blue light exposure, consider using blue light blocking glasses or screen fillers, reducing screen time before bedtime, adjusting device settings to reduce blue light emission, like using night shift mode on iPhones or night light on Android devices, using warm amber-colored lighting in the evening. Remember that not all blue light is harmful. It's mainly the excessive exposure, especially in the evening, that can be problematic for sleep and overall health. Number 2. Irregular sleep schedule. Next up is having an irregular sleep schedule. Going to bed and waking up at different times can confuse your body's internal clock. Aim for a consistent sleep schedule, even on weekends. An irregular sleep schedule, also known as an erratic or inconsistent sleep pattern, refers to a lack of consistency in the timing of when you go to bed and wake up. This can have several negative effects on your health and well-being. Number 1. Disrupted circadian rhythm. Your body has a natural internal clock known as a circadian rhythm, which regulates sleep-wake cycles. Irregular sleep patterns can disrupt this rhythm, making it harder to fall asleep and wake up at consistent times. Number 2. Poor sleep quality. Inconsistent sleep can lead to poor sleep quality, leaving you feeling tired and groggy during the day. Number 3. Increased risk of sleep disorders. Irregular sleep patterns may increase the risk of developing sleep disorders like insomnia or sleep apnea. Number 4. Impact on mental health. Erratic sleep schedules can contribute to mood swings, irritability, and an increased risk of anxiety and depression. Number 5. Cognitive impairment. Lack of regular sleep can impair cognitive functions such as memory, concentration, and decision-making. To improve your sleep schedule, number 1. Set a consistent bedtime and wake-up time even on weekends. Number 2. Create a relaxing bedtime routine to signal your body that it's time to sleep. Number 3. Limit exposure to screens and bright lights over bedtime. Number 4. Avoid caffeine and heavy meals close to bedtime. Number 5. Make your sleep environment comfortable and conducive to sleep. Establishing a regular sleep schedule can help regulate your body's internal clock and improve the quality of your sleep, leading to better overall health and well-being. Number 3. Caffeine and sugar. Habit number 3 is consuming caffeine and sugar late in the day. These stimulants can keep you awake at night. Cut back on coffee and sugary snacks in the evening. Caffeine and sugar are substances commonly consumed in various forms, and they can have both positive and negative effects on our health. Caffeine. Positive effects. Caffeine is a stimulant that can increase alertness and temporarily reduce feelings of fatigue. It's found in coffee, energy drinks, and some medications. Negative effects. Excessive caffeine consumption can lead to jitteriness, increased heart rate, and anxiety. It can also disrupt sleep if consumed too close to bedtime. Some people may develop caffeine dependence or experience withdrawal symptoms like headaches and irritability when trying to cut back. Sugar. Positive effects. Sugars, particularly natural sugars found in fruits, provide a quick source of energy. However, moderation is key here. Negative effects. Consuming too much added sugar, such as that found in sugary drinks, sweets, and processed foods, can have several detrimental effects. Weight gain. High sugar intake is associated with weight gain and obesity. Tooth decay. Sugar can contribute to tooth decay and cavities. Increased risk of chronic diseases. A diet high in sugar is linked to an increased risk of type 2 diabetes, heart disease, and fatty liver disease. Energy slumps. High sugar intake can lead to energy crashes and increased hunger after an initial energy boost. It's essential to consume caffeine and sugar in moderation as part of a balanced diet. Be mindful of your consumption and consider healthier alternatives like drinking herbal tea instead of caffeinated beverages or opting for snacks with natural sugars from fruits or whole grains. Balancing your caffeine and sugar intake can contribute to better overall health and well-being. Number 4. Heavy meals. Eating heavy meals before bedtime is habit number 4. Digesting a big meal can disrupt your sleep. Opt for a lighter dinner or a few hours before bed. Number 5. Lack of exercise. Habit number 5 is a lack of exercise. Regular physical activity can improve sleep quality. Aim for at least 30 minutes of exercise on most days. Number 6. Stress and anxiety. Next, let us talk about stress and anxiety, habit number 6. Worrying and overthinking can keep you up at night. Practice relaxation techniques like deep breathing or meditation. Number 7. Noise and light. Habit number 7 is exposure to noise and light. Make your sleep environment as dark and quiet as possible. Consider using earplugs and blackout curtains. Number 8. Overuse of sleep aids. Using sleep aids excessively is habit number 8. While they can help occasionally, relying on them can lead to dependency. Consult a healthcare professional if you have persistent sleep problems. Number 9. Ignoring sleep disorders. Last but not least, habit number 9 is ignoring sleep disorders. Conditions like sleep apnea can seriously impact your sleep quality. If you suspect you have a sleep disorder, seek medical advice. If you're a book reader, do read the 3 books mentioned in the description for more enlightenment on the following topic. So, there you have it, 9 habits that can ruin your sleep. The good news is that with a few adjustments to your daily routine, you can improve your sleep and wake up feeling refreshed. If you found this video helpful, don't forget to like and subscribe for more sleep tips and advice. Thanks for tuning in and sweet dreams.